Hello everyone, welcome to Diagnose It. So now let's discuss our new case. So a 4-year-old child is presented with port wine stains on the face. As we can see in the image, there is presence of these port wine stains. There are presence of neurological manifestation, presence of glaucoma and hyperplastic lesions intraorally. So based on these findings, we can say that it is a case of Sturge-Weber syndrome. Sturge-Weber syndrome, also known as SWS. So what is this Sturge-Weber syndrome? So the Sturge-Weber syndrome is basically a neurocutaneous disorder. Which is characterized by the angiomas of the face, choroid, and leptomeninges. So what is an angioma? So angioma is basically just a benign growth which is made up of blood vessels and lymphatic vessels. So it is a sporadic development disorder. Sporadic means irregular, which is caused by the somatic mutation in the GNAQ gene. GNAQ gene mutation, which is present in the long arm of chromosome number 9. Port wine stain is it is basically a vascular malformation of the facial capillaries, and it occurs around the areas which are innervated by the trigeminal nerve. The trigeminal nerve innervated areas, the fifth cranial nerve. Why? Because the trigeminal nerve is one of the first cranial nerves to develop, and also this Sturge-Weber syndrome is also known as the encephalo-trigeminal angiomatosis. Now, if we break the word, then the encephalo stands for the brain, the trigeminal stands for the fifth cranial nerve, and the angiomatosis means the malformation of the vessels. So this was the basic introduction about the Sturge-Weber syndrome. So now let's talk about what happens in the Sturge-Weber syndrome. So basically in the week 6 of a developing embryo, the cephalic portion of the embryo grows. Also, with the growing embryo, a network of the tiny blood vessels, which is known as the vascular plexus, it is formed and which supply the neural tissues. So now our gene, which was earlier we taught as the GNAQ gene, it codes for the guanine nucleotide binding protein. And now this gene is responsible for the development of this vascular plexus and also its growth. So now what happens in normal cases, what happens in week 9, the expression of this GNAQ gene, it regresses or stops, and hence the vascular plexus also regresses. The vascular plexus also regresses in the normal cases. But now what happens in the Sturge-Weber syndrome? In the Sturge-Weber syndrome, the expression of this gene, that is the GNAQ gene, it does not stop, and hence the vascular plexus does not regress, which leads to the excess of capillaries in the tissue ectoderm. Excess capillaries formation occurs. And hence, due to this excess capillaries formation, we see the most common presentation of the Sturge-Weber syndrome, which is the unilateral and complete port wine stain. Depending upon the mutation, whether it occurs early or late, the Sturge-Weber syndromes port wine stain can be unilateral or bilateral, and also it can be incomplete and complete. Also in the brain, we see a specific finding that is known as the leptomeningeal angiomas, which also occurs due to the vascular malformation in the meninges, and hence leads to the effective venous drainage. Now let's talk about the common manifestations which are present in the Sturge-Weber syndrome. So the first neurological manifestation which appears in the Sturge-Weber syndrome is the presence of seizures. The seizures can be atonic, tonic, and myoclonic. These are the first neurological manifestations. And then there occurs the port wine stains. Port wine stains are commonly present, but not all patients with port wine stains have Sturge-Weber syndrome. If the port wine stain is involved in it involves the both upper and lower eyelids, then there are increased chances of the glaucoma. These port wine stains are also known as the nevus flammeus. So these are present around the areas which are in the vicinity of the trigeminal nerve, basically around the upper eyelid and the regions around the eye. Now let's talk about the glaucoma. So what happens is that the capillaries around the fifth cranial nerve, they affect the eyes on same side, which leads to the pooling of blood and obstruction of the venous outflow, and hence it leads to the high episcleral venous pressure. Due to all this, there occurs the congenital trabecular dysgenesis, due to which there is the underdeveloped trabecular meshwork forms, and hence this trabecular meshwork strains the aqueous humor, and hence due to the abnormal or underdeveloped development of this meshwork, there occurs the abnormal drainage of aqueous humor, and hence which leads to the development of the increased intraocular pressure, and hence it causes the glaucoma. So these three are the one of the major manifestations which are present in the Sturge syndrome. Now let's talk about the diagnosis part. So in the diagnosis, we can offer the patient with a brain's MRI scan. The brain's MRI, and in this MRI scan, the most important or the most common targeted areas which should be primarily seen are the occipital area and the posterior temporal region. So these are the area where some malignancy or manifestation can be found. So these are the lobes, the occipital and the posterior temporal lobes. Another modality which can be offered is the FDG PT scan. So what this FDG PT scan stands for? FDG stands for the fluorodeoxyglucose. And this POT, you all know that what is it? The positron emission tomography. So it is quite a useful modality which is used to study the cerebral metabolism in the patients. The cerebral metabolism is studied using this test. Now in the affected areas, there is the presence of hypermetabolic state in the early stages. So in the affected areas, there is hypermetabolic state in early stages of the disease. And there is hypometabolic state, hypo in the late stage. Other can be, we can see that there can be presence of these seizures and there can be presence of a port wine stains. So these are some of the manifestations which also help in the diagnosis part. So now talking about the treatment part of the Sturge syndrome. So as such, there is no cure for this disease, but what we can do is we can minimize the seizures. The seizures can be minimized with the help of the anticonvulsive medications. Also, surgery is advised in patients who fail the medical management of seizures. So surgery is also advised in the patient who does not show good results in the seizure treatment. So the surgical procedures can be hemispherectomy or the focal resection of the seizure focus. So what we can do is the hemispherectomy or the focal resection. Hemispherectomy or focal resection of the seizure focus. And also the low dose aspirin can be effective in decreasing the frequency of seizures and the stroke-like episodes. So this was all the treatment part, and this was all about the Sturge syndrome also. So thanks for watching. Don't forget to like, subscribe, and share Diagnose It, and also do make sure to follow us on Instagram. Thank you.